Good morning to everyone. Greetings to all. Myself is Vimal Justin. Today we are going to discuss about an interesting topic called gastrointestinal agents. First and foremost, what is gastrointestinal agents? Gastrointestinal tract is a set of organs beginning from the mouth and ending in the anus. It is a pathway by which food enters the body and wastes are expelled. What are the diseases of GIT? Hyperacidity or ulcer, excess of acid secretion, hychlorhydria or hychlorhydria, inadequate secretion of acid in stomach, diarrhea, inadequate absorption of mineral and fluid in large intestine, constipation, insufficient peristaltic movement of large intestine. Drug used in the treatment of GI disorder are known as gastrointestinal agents. Next classifications: antacids, acidifying agents, protectives and absorbents, saline cathartics. Antacids, drugs which neutralizes the excess of HCl secreted in the stomach. Example: aluminum hydroxide gel, sodium bicarbonate, calcium carbonate, etc. Acidifying agents, drugs which increase the gastric acidity. Example: dilute HCl. Protective and absorbents used in the treatment of diarrhea. Example: kaolin. Saline cathartics used to relieve constipation. Example: sodium potassium tartarate. Next, antacids. Antacids are substances which are used to neutralize the excess amount of acid in our stomach, which may cause many severe problems like pain, ulceration, and also inactivate the pepsin. The stomach pH can range from pH 1 when empty to pH 7 when food is present. The low pH is due to the presence of endogenous hydrochloric acid. When hyperactivity develops, the results can range from gastritis to peptic ulcer. Ideal properties: it should be non-absorbable and should be not interfere with food absorption. It should not cause constipation. It should act rapidly for a prolonged period of time. Its pH should lie within the range of 4 to 6. It should not evolve a large amount of gas and reacting with gastric hydrochloric acids. The classifications are systemic antacids and non-systemic antacids. Example for systemic antacids are sodium bicarbonate, and non-systemic antacids are aluminum salts, magnesium carbonate, and sodium carboxyethyl cellulose. Next, aluminum hydroxide gel. Molecular weight of aluminum hydroxide is 78 gram per mole. Preparation: it can be prepared by treating an aluminum salt with ammonium hydroxide. Properties: appearance white amorphous solid, odor odorless, solubility: it is insoluble in water and ethanol but soluble in acids and alkali solutions. Chemical property: it gets converted to aluminum oxide on heating. Pharmaceutical formulations: oral suspensions, marketed preparations: alternagel, nephrox, amphogel. Storage conditions: it should be stored in plastic containers and freezing should be avoided. It can be dispensed in blue or amber colored bottles. Uses: it is used to treat ulcer, gastritis, peptic, gastric hyperactivity, and also it is used to protect the skin. Next, magnesium hydroxide. The molecular weight of magnesium hydroxide is 58.3197 gram per mole. And preparation: treating the solution of different soluble magnesium salts with alkaline water includes the precipitation of the solid hydroxide. Properties: appearance white powder, solubility soluble in water. Chemical properties: at pH 10, magnesium hydroxide is alkaline to litmus solution and absorbs carbon dioxide from air. And the pharmaceutical formulation is suspension. Market preparation: milk of magnesia. Storage condition: it should be kept in original container It should be avoided in indoor storage areas and at least 1 meter away from heating devices. And its uses are it is non-systemic gastric and mild cathartic, but on continuous or prolonged use, kidney stones may develop. Molecular weight of magalrate 164.36 gram per mole. Magalrate acts as an antacid which is used in the treatment of various conditions in GI tract such as esophagitis, duodenal and gastric ulcers, etc. Properties: it is white or almost white crystalline powder. It is practically insoluble in water and ethanol. It is soluble in dilute mineral acids. Pharmaceutical formulations, oral suspensions, market preparations, Riopan. Storage conditions: tablets and capsules should be stored at room temperature. Refrigerator is used to store the liquid form of this medication to improve taste. It is used to treat gastric and duodenal ulcer. It neutralizes gastric acid and increases gastric pH.